My name is Dr. Kylie Rhodes. I'm a family medicine physician with Fayetteville Family with Washington Regional. I grew up in Pittsburgh, Kansas, which is about 2 hours north of here, and then went to medical school in Kansas City at KU. I have a family, a husband, and 3 kiddos that are elementary school and younger. We really love Northwest Arkansas and being outside. I'm big into mountain biking and running, and we love just hiking all the trails and getting outside and experiencing all of that. So I have known I wanted to be in medicine since I was about 9 years old. My mother was an emergency room nurse, so I always had a little bit of exposure, and I started shadowing and everything else through middle school and high school. What I enjoy the most about family medicine is that I get to take care of a little bit of everybody, from young kiddos all the way up to our seniors, and I get to see the whole spectrum of different diseases and take care of families, so I get to understand that dynamic a little bit and how that plays into people's health. I think there's a lot of misinformation about how healthcare works and what kind of our goals are mostly for patients. I think a lot of people don't quite understand what a wellness visit is, and it being a preventative visit versus a visit where we focus on problems. I think giving patients realistic expectations of how long it's going to take maybe to sort through a problem or what the process is going to look like. I try to do a good job at giving them some guidance as to what to expect if I'm sending a referral or ordering tests, starting a medicine, and make sure that we're working together to understand what the plan's going to be and that we both agree that it makes sense for that particular patient. When my youngest was 6 weeks old, she ended up very sick with RSV and ended up in the PICU at Washington Regional, and we had a fantastic experience with the doctors, with the nurses, with how everybody took care of us and took care of her, and it made me start exploring them as an employer, and very quickly found that the atmosphere here is very patient-oriented. It's a nonprofit, so the focus is making patients healthy, and there was a lot more focus on evidence-based medicine and practicing what makes the most sense for everybody.